All right, good to go? Okay. All right. So thank you everybody so much for joining us tonight. We are so excited to bring you this conversation around running during pregnancy. Our vision and inspiration for this clinic was to have a conversation to educate you about pelvic health considerations during pregnancy and running biomechanics during pregnancy and running, and also strength training that can help support your running during pregnancy. We really want this to be a conversation that empowers you and enables you to take all of these considerations and information that we're going to go over to enable you to make the decision that is best for you, your body, and your pregnancy around running and what feels good to you. So I'm going to start off by introducing our team tonight that we are so fortunate to have here with us. We're going to start off with Mbong Henry. Mbong is the owner of Radiant Physical Therapy in Durham, North Carolina. She earned her BS in kinesiology and then went on to earn her doctorate of physical therapy in 2009. Inspired by her own personal experiences with running and pregnancy, Mbong went on to further her education in pelvic health, and that's what she specializes in now. We're so excited to have her join us this evening. She truly is a wealth of knowledge, and I really love her approach to pelvic health. Next, you're going to hear from Sam Hedges. Sam is the owner of Volt Movement. Volt is a endurance coaching and sports performance business. She is also a physical therapist at Upright Athlete in Durham, North Carolina. She earned her doctorate in physical therapy and has since furthered her education with dry needling, functional range conditioning, manual techniques, and most recently became a USA Triathlon certified coach. We're really grateful to have her expertise and energy with us tonight. Wrapping things up will be me. My name is Joy Black. I am a pregnancy and postpartum exercise consultant with Upright Athlete, and I also coach, train, and empower women through strength training during pregnancy and after. I am a National Academy of Sports Medicine certified personal trainer, pregnancy and postpartum exercise specialist, pregnancy and postpartum athleticism coach. I love integrating strength training through pregnancy and postpartum and have done lots of continuing education that allows me to integrate different concepts that I've learned into the strength training during pregnancy and postpartum. I'm really excited to be here with you tonight. So we need to let everybody know that this talk is for educational and informational purposes only. This should not be construed as personal medical advice. Please consult your healthcare provider prior to starting a new exercise program or taking action. And lastly, in full transparency, we are not trying to sell you a program tonight. We are solely doing this to give you information to empower you. That being said, we are each a small business. So every time you support us, recommend us to a friend, tag us in social media, or really even just tell us that we're doing a good job, we all literally do a little happy dance. So thank you so much for supporting us tonight, and please allow us to empower you with some information. All right, so that's enough for me for now, and now I am going to stop my screen share and pass it on to Mbong. All right.
Hey, everybody. Good to see y'all tonight. So we're going to get started here. So thank you, Joy, for that lovely introduction. So as she mentioned, I'm a pelvic health and orthopedic physical therapist. If you don't know what a pelvic health physical therapist is, a pelvic health physical therapist has additional training for internal and external assessment and treatment of the pelvic floor. And so we're really excited to connect the dots for any of you pregnant or postpartum runners. So some of the objectives for tonight will be to talk about what is pelvic health PT, where the pelvic floor is and learn what it does. We'll go through some pregnancy considerations with running, and then we'll talk about the common reasons for a postnatal or pregnancy pelvic PT visit. So pelvic health PT is conservative treatment or rehab for pelvic floor related or abdominal wall related issues. This includes bowel, bladder, digestive, problems, or if you have an issue with your back, pelvis, hip, or tailbone. All genders have a pelvic floor, so anybody can benefit from pelvic floor PT. This talk is specifically going to look at pregnancy and postpartum considerations. And then if we look at the anatomy or where those pelvic floor muscles live, we can appreciate how expansive they are inside our body. So if you follow my blue dot here, you can see how they connect onto the front of your pubic bone internally. They come down to your tailbone and the lowest part of the back. They have connections onto the sacrum in the lower back. And they also have connections inside the pelvis coming down into our thigh bone, the femur bone, which is not seen here. So it's really great to know where those muscles live, because sometimes people will have problems or pain and it may be related to a muscle. We can also appreciate the 3 openings. We have the urethra where pee comes out in females. We have the vaginal opening where babies come out if you have a vaginal birth. And then we have the anal opening where we poop. So what does the pelvic floor do? It has quite a few jobs. One of the biggest jobs that everybody seems to be aware of is continence. So it's that ability to hold in or let out our solids, liquids, or gas, which would be pee, poop, or gas. The pelvic floor muscles have a role in us being able to appreciate sex and our reproductive health. If you're having or had a vaginal birth, that's where the baby will come out. The pelvic floor muscles have a great role in helping manage the pressure within our belly, which is what we call the intra-abdominal pressure. And those muscles act like a great sling for our pelvic organs. It's really important to know that the pelvic floor muscles operate like other muscles with a balance of strength and flexibility. So sometimes people think it's all about the Kegel, which is just a squeeze, but it's also important to know that those muscles need to be able to relax and lengthen. They need to be able to respond to impact and exertion. And in this picture, you can appreciate how the pelvic floor is a team player with the deep abdominal muscles, our transverse abdominis, our diaphragm, and our spinal muscles. And then Joy will go a little bit into inter-abdominal pressure on her section. So now when we're looking at pregnancy considerations when it comes to running, here in the US, we follow the American College of Obstetricians and Gynecologists guidelines for exercise. And exercise is great during pregnancy. Running is considered safe. And unless there's a medical reason or a obstetric complication where you should not be exercising during pregnancy, there are so many benefits that women get from exercising or running, if you were running before, that it's good to continue. The recommendations are 150 minutes of moderate intensity exercise a week. Some of you may be accommodated, used to doing more than that, which is great. It's just really important to talk to your personal OB or midwife about what that looks like for your pregnancy and your activity levels, because you want to take into consideration making sure you're managing your blood sugar and everything else appropriately if you're running for longer periods. As far as intensity goes, ACOG recommends using the rating of perceived exertion scale, which you want to be, moderate intensity would be between a 13 and a 14, which is somewhat hard. And one way to know how hard you're working is being able to have that talk test. So they also recommend twice weekly strength training, which is actually really key for runners. So we want to include that strength training for our muscles and our bone health to decrease the injury risk. And then we're also looking at avoiding contact activities that may have a risk of belly trauma or falls. Now, that being said, with exercise, it's important to familiarize yourself with red flags on when to stop. So these are when you would want to check in with your provider. So if you're experiencing any vaginal bleeding, abdominal pain, feeling dizzy or faint, if you experience any shortness of breath before you even start exercise, if you have chest pain, headache, any muscle fatigue or weakness that might affect your balance, if you have any calf pain or swelling, or if you're experiencing any regular or painful contractions, or your water's broken, which would be that leakage of amniotic fluid. Now, during pregnancy, it impacts our whole body. So oftentimes we just see some of the external changes, but it does affect our cardiovascular system, our hormones, which influences our ligament and joint laxity, and the respiratory systems. I'm going to just highlight some of the key ones that happens to our muscles and the skeletal system. So it's perfectly normal, and we expect to experience some weight gain during pregnancy. The muscles in the abdominal wall will stretch out as the baby grows, and that's perfectly normal. Your pelvic floor is also going to stretch during pregnancy due to the weight of the uterus and the growing baby. And it doesn't matter actually how you deliver, just being pregnant will actually cause a little bit of strain on your pelvic floor. And we will notice some changes in the breathing pattern as the belly grows and the diaphragm shifts up. And a big one for runners is that the center of gravity will shift. And when Sam talks, she will highlight those changes. Now, it's important to know that having these changes doesn't mean you're going to have symptoms. Big picture wise, it's important to plan mentally and adjust your running due to these normal adaptation that your body's going to experience. Some women do well with support wear, so that might be like a belly band. With running, sometimes it's you need more supportive bra. You might change your footwear due to some of those changes. But a lot of people think, being pregnant means you're going to be in pain, and that's not the case. When we're looking at considerations for modifying our running, we want to look at that we're just in a season of life, right? So if you need to make changes sooner than you anticipated, that is completely okay. It's just a season. It's not forever. It's just for now. And with pregnancy, there's oftentimes things that are outside of our control, right? So y'all are here because you're excited, you want to plan, but there may be, you may start off low risk and might need to make adjustments due to a medical complication or something going on with you or the baby where it wouldn't be appropriate to be running. So just to allow you to exercise some self-compassion and as well as to be opening to pivoting, right? Because life is unpredictable and birth is very unpredictable and new babies are also unpredictable. And we've all kind of been there through this past year as we've been living through the pandemic, and we've learned how to pivot and adjust and be adaptable in different ways. Now, these are some opportunities where you can look into modifying and seeing a pelvic physical therapist. So if you're experiencing any hip pain, back pain, or pelvic pain that's stopping you from doing your regular routine or running, that's an excellent time to check in with a pelvic PT. If you're experiencing any pelvic pressure or vaginal heaviness, again, see a pelvic PT and see what they can offer you there. If you're experiencing any leakage with activity, or if you have the urge to go to the bathroom and notice that you leak on the way there, again, physical therapy can be of benefit to you. Now, with the changes I mentioned before, it doesn't mean that you're going to experience any of these things. As a physical therapist, I see people who have the need, and there's many people who don't have these issues and are able to continue to keep running or doing their usual routines. It's just important to know if any of these do come up, that you can get help and you don't have to sit in pain or suffer in pain. It's important to look at different ways you can adjust your exercise. So you might be changing your pace for your symptoms, modifying your intensity. Perhaps if you were a 5-day-a-week runner, you might decrease some of the frequency, or you might transition to some walk-run intervals as you need to. With looking at reaching out to a physical therapist, your provider may not recommend one to you. So it's important to know and be empowered how to advocate for yourself. Now, if we fast forward to you've had your lovely baby and you followed up with your provider and they say you're clear to exercise, there's a lot of factors that go into being ready to run. And so oftentimes providers may say, do whatever you want and listen to your body. But sometimes women are not quite sure what to listen for. And as that medical checkup at 6 weeks is extremely important to keep, it's going to be different than what a pelvic health physical therapist will assess when it comes to your pelvic floor muscle function and capacity. We want to consider the 4th trimester, which is that additional 6 weeks after your first 6 weeks, where a lot of healing is going to be continuing to happen. And it's really important to know that in that time, there's a lot of hormonal changes in our connective tissue. And it's helpful to kind of modulate some of your expectations of early postpartum and look at some of these changes may affect our physical health and our mental health. With life and particularly pregnancy, you may have had a pregnancy or birth challenge. Things don't always go as planned. And oftentimes an injury or an outcome that was different than we expected can really impact our mental health. So it's really important to be able to nourish that and get support when you need to, because that will actually affect your body's ability to heal and get back to the things you want to do. I mentioned the ACOG committee opinion here from 2018, where they talk about highlighting the fact that we need to give more attention to the fourth trimester. They have found that for some people that instead of a 6-week checkup with your medical provider, we may not need to wait that long, and that checking in, it may just be even a phone call with your provider at 2 weeks can really make a difference in some of the maternal outcomes. And then, we have a 2-week follow-up, a 6-week follow-up, an additional follow-up, again, to just keep track of mom and see how she's doing. All in all, they really do support just paying attention to all these different things that are happening in the body. In this committee opinion, they recommend pelvic PT for any pelvic floor pain or cesarean scar pain, or referral to a urogynecologist as needed. So your provider may not initially refer you to pelvic PT, but again, in the spirit of being educated and advocating for yourself, if you're having any symptoms that don't feel right, it's important to know who to reach out to and have a team to support your goal. And then, so now if we're looking at some readiness to run after your baby has been born, we want to consider looking at what happened during your pregnancy. You may have had horrible morning sickness or some medical complications. You may have been on bed rest and you perhaps were not able to run in the way that you wanted to during your pregnancy. That is completely fine. It's important to really respect where your body is going to be given the several months of some deconditioning that's happening. If you had an easy pregnancy, your birth was very straightforward, minimal tearing, getting plenty of sleep, again, that will look different than if you had complications. For some people, they have a very challenging labor and you push for hours and maybe have a cesarean. So again, that is another form of strain on the body where we want to really be mindful of the healing that's occurring physically and disability that to transition into motherhood. A lot of people underestimate some of those motherhood transitions and how that will, caring for a new baby who doesn't sleep, which is expected. We don't know, they're not expected to sleep when they are brand new. That really does impact our healing. So looking at just in general, like how are you doing with fatigue? How is your social support? Do you have a return to work deadline that may be contributing to some stress or anxiety? And then really giving yourself some cushion as you slowly, gradually get back to the things you want to do, and knowing that that early postpartum period is important to rest and slowly get back to what you need to do. Everybody's journey is different. So again, not comparing yourself to somebody else who maybe had a completely different birth experience, just respecting where your body is for what you went through. Now, if we look at some common reasons to see a pelvic physical therapist, we want to look back at what the jobs of the pelvic floor do. So, right, if we're experiencing any bowel or bladder issues, so any bowel or bladder leakage, any urgency, if you woke up a million times during your pregnancy at night to pee, and now you've had your baby and you're doing the same thing, we would want to address that with pelvic PT. If you're experiencing any scar pain in your cesarean scar or your perineum, or having any pain with sex, pelvic PT can help with that. If you're experiencing any pain in your hips, back, belly, or pelvis, and I put the asterisk because a lot of runners, not all runners, but some runners have pain during pregnancy. And then when they go to resume running postpartum, they experience that same pain. So again, we can address these things and help build that foundation, help you with healing as you're reaching back towards your goals. Pelvic PT can help with any abdominal muscle strength concerns, any symptoms of pelvic organ prolapse, which might be pelvic heaviness or pressure. And then you may not have any symptoms at all, but you may just be curious about what it looks like and figuring out if your body is ready to head back into impact sport like running. And that would be a perfect time to check in with the pelvic PT. And then to wrap up, I'll just give an overview of the Return to Run guidelines that were published in 2019 by Tom Goom, Emma Brockwell, and Grania Donnelly. And they did a really comprehensive search of the available evidence, and they found that there's a high level of evidence for pelvic floor PT, for stress urinary incontinence, for pelvic organ prolapse, and for pain with sex. But there wasn't a ton of guidelines for women returning back to running, specifically postpartum. So they came up with an expert list of about 20 clinicians around the world. And together, they put together these recommendations to help guide individuals as they head back to running. So biggest thing to start with is we're looking at that consideration for postpartum healing, right? So we're respecting the 4th trimester. We're encouraging people to do some postnatal rehab for any pelvic floor or abdominal strength concerns. We're going to start off with some low impact exercise while we're in that healing process and gradually build strength. Then initiating a graded return to running, so walk, run type of thing, around 3 to 6 months postpartum. So again, it's a range because everybody's different. Some people will need more time, some people will need less, and it just depends on what your body has gone through during your pregnancy and postpartum. You're going to continue to keep watching for any musculoskeletal pain or pelvic floor symptoms, and that's a sign that you may be doing too much. So again, we're scaling appropriately. And then we also just have some big considerations for that initial postpartum time, right after 6 weeks, and going into 12 weeks postpartum. There's still a lot of demands on the body for healing. And it's really important to have adequate nutrition, as well as adequate recovery and sleep. So just like if you were training for any other sort of activity, if you're not nourishing yourself right, not recovering or sleeping right, you do have a higher risk of experiencing an injury. And then if you're breastfeeding, there's additional nutrition needs as well as just the stress of figuring it all out, because it may not come naturally or easy for everybody. And so putting all these together for each individual as they look through their risks. So that's it for me. I am going to stop my screen share and pass it over to Sam.
All right. Can you guys see that there? Okie dokie. So we're going to keep this rolling here. Thank you, Mbong, for all of that information. That's an awesome start leading into now more of the running biomechanics aspect. So as Joy mentioned earlier, I'm a physical therapist, but also a USA Triathlon certified coach. And I want to start off by going through just some objectives here of this part of the presentation. So considerations for pregnancy based on physiological changes. Then I'm going to go into running biomechanics based on gait cycle, and then understanding and mitigating risk of injury, and then interventions for rehab and injury prevention. So starting off here with pregnancy considerations, some of these things Mbong already discussed with us as well, but starting off with that change in center of mass. So as we start to grow and our belly is getting bigger and going out more in front of us, that is a consideration for running because we normally want to keep our foot strike close to our center of mass. So as that center of mass changes, that's something to consider as we strike the ground. Then we're going to have that increased ligament laxity. So that's going to affect just our joint stability and making sure that we're providing that stability through our muscles as well. Increase in lumbar extension. So as our belly starts to go forward and we're getting more of that lumbar lordosis, that of the lumbar spine, we want to make sure that we're keeping the core especially engaged for a lot of these movements. We don't want to create more lumbar extension during running. So that's definitely something to consider. Potential decrease in ability to flex the hip just by having that range of motion to get your hip into that position with your belly there. So that's something to consider as we start to grow and our belly starts to grow. So we want to make sure that we're just monitoring our range of motion and ways that we can compensate for that. Then there may also be swelling of lower extremities, feet, ankles. So that's when we might want to consider what type of shoes we're wearing, any compression stockings, things like that. And then, as Mbong mentioned, totally normal, our weight gain that's going to happen during this period as well. So just ways that we can talk about load and how we can make sure that we're minimizing our load with the ground and the forces that are going to be coming back through our body. So I'm going to then go into how the phases of running can be broken down and considerations during each phase. So as we start to ask ourselves some of these questions, I do want to make a point of saying that, you know, if you're starting to see that you've got some inefficiencies with your running form, that does not mean that it's unsafe. It's just something to consider, and it's more education for you to have so that you can know ways that you can prevent injuries. So the questions that we want to ask ourselves during initial contact. So as you can see here, initial contact is as the foot is about to strike the ground. So where do you strike the ground? For example, in this picture, she's about to strike the ground with her heel. Then they're striking with the midfoot, the center of the foot, and then forefoot, which is the ball of the foot. Where is your shin in relation to the ground? So is it perpendicular with the ground? Is it extended? Here in this picture, it's a little bit extended, or flexed under our bodies. And then how far away from your center of mass do you strike the ground? The further that we strike away from us, the more that we're creating load through that leg, through our shins especially. So the next part of this is those common injuries based on the answers to those questions. So heel strike, like you can see here in the picture, is going to increase load to the anterior musculature. So that is all of the muscles that run through the front of our shin. And this is going to increase the risk of load to those shins. So shin splints, knee pain, things like that based on the heel strike. Forefoot strike, this is striking on the ball of your foot. That's going to increase load to your calf muscles and your Achilles. Neither one of these is better than the other. It's just knowing what effect that does have. So if you're someone that, for example, has calf strains frequently, then that's something for you to know, especially if you are someone who's running on the ball of your feet. So it's just more information to have. One is not better than the other. Then extended shin, like she has here in this picture, that's going to increase the load to the shins and knees, in addition to striking further away from center of mass. All of that is just increasing load to that area. We want to make sure that we're minimizing that excessive load through our shins and knees as much as possible. So we're really having our weight through center of mass when we strike the ground. And then how do we mitigate this risk? Some of this I've just discussed. So consider which striking pattern is best for you based on your previous injuries and your current biomechanics. One way is not better than the other, and everyone runs a little bit differently. So looking at your past history and then how you currently run and making sure that we're mitigating risk of injury for you. And then neuromuscular retraining. Some of these inefficiencies are due to decreased strength, but some of them are just you're used to running that way, and that's how you've always run. So understanding how you're running and being able to look at that from a biomechanics perspective and kind of retraining your muscles to move in a different way is part of the process. Then we're going to go into the next phase of gait. So this is mid stance. You can see in the picture here, she's now fully weight bearing through that leg. She's more in that single leg stance position as she swings the other leg forward. So questions to ask ourselves in this position: do we have a pelvic drop? Is our arch collapsing to the ground? How much are our knees and our ankles flexing in this position? And do our knees stay over our laces, or are our knees kind of coming in towards our midline? Based on the answers there, common injuries from these biomechanics, if we have a lot of pelvic drop or we have a lot of what we call hip dipping, that can kind of collapse the lower leg or increase our hip, knee, and ankle injuries from that, especially considering ligamentous laxity here. If we're getting a lot of movement, side to side movement, especially of the joints, and then we're getting a little bit more laxity of some of those ligaments, that can increase some of the stress in that area. So we want to make sure that our muscles are strong enough to control some of that collapse. Then excessive arch collapse. So if you're someone that's noticing your foot's dropping all the way to the floor when you're in single leg stance, that can irritate the plantar fascia, can also irritate the Achilles. Stiffness of the knees and the ankles, if you're not getting a lot of bend of either of those joints, that's just going to increase the load to the joints themselves. So we want to make sure the muscles, again, are strong enough to support that single leg stance position, which Joy is going to go into in more detail later on. And then knee valgus. So this means when our knee is coming in towards the midline of our body, that's going to increase the stress on the inside of the knee. It can also increase stress on the IT band and our lateral hip. Again, with strength of some of those structures, we can control that movement and make sure that we're not relying on the joints or the ligaments themselves to stabilize. How do we mitigate this risk during mid stance? Glute med strengthening is fantastic for preventing pelvic drop, and it also controls the position of the knee. Foot intrinsic strengthening is going to prevent that collapse of the foot. That can also go up the chain, so it can prevent the collapse of the knee, and it can prevent some inefficiencies that are happening at the hip. And then increased stability around the knee is going to allow for a really comfortable and confident single leg squat position, which is a huge key for mid stance. Running is basically single leg squatting over and over and over again. So if we can get really confident and have a lot of control in that position, it's going to be incredibly beneficial. The next phase here is our terminal stance or our push off. So you can see here, this is as she's starting to drive off with that back leg and push yourself forward. So how much hip extension do you have, which means how much can you get that leg behind you? Do you pronate or supinate at push off? This means, is the arch collapsing, or are you kind of favoring the outside of your foot as you push off? And then are you pushing up or are you pushing forward? Based on the answers there to those questions, decreased hip extension. So if you're not able to really get this leg behind you, it's going to decrease your stride length. It's also going to increase your vertical oscillation, which means you're going to be bouncing up and down more than you're going forward. Also, if we don't have enough hip extension, we like to compensate with our low back. So you can even see in this image, she's got a little bit of that curvature of her lumbar spine, which if we already have a little bit more of that because of pregnancy, then we're going to increase that, which is something that we really want to consider and be very mindful of. If you have pronation at the end of your stride, so like I said, if that's arch is still collapsing as you push off, that's not only going to decrease your ability to have power and push forward, but it's also, again, stressing that plantar fascia and overstretching that area. And then if you're doing the opposite, if you're kind of favoring the outside of your foot as you push off and you notice that your big toe isn't really in contact with the ground when you push off, then that's going to decrease the power, but it's also increasing stress on the fifth metatarsal, or that last toe bone, which it's a pretty small bone. It doesn't like to have a lot of stress through it. So we want to make sure that we're not completely loading the outside of our feet as we go to push off. So then increased bouncing, like I said, if you're going up and down, if you're someone that your hair is just moving all over the place when you are running, that's putting a lot of load through the joints. So what goes up must come down. And especially if you're someone who is having some of that leaking when you're running, that's something that you would want to mention to your pelvic floor PT. And that's a huge consideration, is this phase of the gait and how much vertical oscillation you have. How do we mitigate this risk? Hip extension strengthening is huge so that you can have the ability to get that leg behind you and utilize your hips instead of your low back when you are pushing off. That's going to improve the direction of push off, and it's going to decrease the compensation. If we have more foot intrinsic strength, that's going to allow for proper push off through the foot and utilizing our big toe. But things to consider there is that if you don't have the range of motion of your big toe, or if you don't have the range of motion of your ankle to get into that position, then you're not going to have the strength in that position either. So we want to make sure that we have the range of motion to get into these positions, in addition to having the strength to utilize those positions. The last phase here is our swing phase. So you can see this is how she's driving that knee forward in front of her. So important considerations here. How far off the ground are you bouncing? Again, what direction is your knee actually driving? You can see it in this image. She's doing a great job of driving her knee forward under her body. Are you using your arms? So are you utilizing the arms here? And how much hip flexion do you have? Common injuries based on this If we're not using our arms, we're decreasing our power, but we're also forcing our lower body to do all of the work. So we want to really utilize our upper body when we can. Knee drive, if you are someone that's knee driving in towards your body, that can lead to crossover of the leg. So wherever our knee is driving is where our foot is going to land. We want to drive the knee directly through the body and land in that proper position. If we start to cross over, then that's going to put a lot of additional stress on the lateral structures like the IT band. If we have decreased hip flexion, which we've talked about might happen as our belly starts to grow, then we want to make sure that we do have the knee range of motion and the ankle range of motion to still get into a proper position and avoid a tripping hazard. How do we mitigate that risk of injury? Neuromuscular retraining, again, is part of this to make sure that we're utilizing our lower body and our upper body separately. Obviously, that can start to be a little challenging as you've got a belly growing in front of you. So making sure that we're still remembering how to use rotational muscles, especially as you go into postpartum training and running. We don't want to lose the strength of our rotational muscles, and we want to make sure that we know how to engage our lower body and our upper body differently. Improving hip strengthening is always going to be important here, and strategizing ways that we can still get different range of motion of our knees and our ankles, even when we're not able to get our hip all the way through into that knee drive. Intervention. So what do we do with all of this information that I just threw your way? So the first thing that I would advise, is obviously talking with your pelvic floor PT, talking with all of your staff that you have around you. And then if you're at the point where you want to make sure you're getting a running analysis so that you can continue to run and understand your risk of injuries, then we've got 2D running analysis and 3D running analysis. So even if, you record yourself running, and you can always send it in, have us look through that running form and give feedback. It's just a great way to understand how you're running and how you can make sure you continue to run safely throughout your pregnancy and through your postpartum experience. So as I talked about, making sure that you have the range of motion to get into some of these positions. So that's when we utilize soft tissue mobilization, myofascial decompression, or cupping, so that we have the range of motion to get into those proper positions. And then strength training, which Joy is going to give you all of the good details on, is critical for making sure that you can really utilize your body and keep yourself healthy through this process. And part of that is functional mobility training. And then lastly is shoe fit consultation, making sure that you are wearing the proper shoes throughout your pregnancy as your body is changing, and keeping the things that we can control comfortable for the entire process. And so I am now going to hand over everything here to Joy. I'm going to stop my screen share.
All right, let me get mine going. All right, go. All right, awesome. So we are at the last part of the presentation, and I know that we've all been sitting for a little while. So what I want you to do is I want everybody to stand up. So if you can, just go ahead and stand on up, and we're going to do 10 squats with an overhead reach. Okay, so all I want you to do is just squat down and then reach overhead, and I'm going to do it with you. So here we go. We got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, you can sit down now. Okay, so we had our little movement snack, and everybody's awake now, and we can get on with the rest of the presentation. So what am I going to talk to you about today? I'm going to talk to you about why you should strength train. I'm going to talk to you about, is it safe for you to strength train during your pregnancy? How do you make your strength training running specific? How in the world do you find time to fit it in? And what about your core? Can you train your core during pregnancy? Should you train your core during pregnancy? How do you go about doing that? So before I take a deep dive into specific strength training for pregnancy, I feel like it is important for us to understand why strength training is important from a broad perspective. So it's not only important during pregnancy and postpartum. From a very young age in life, we need strength. Strength gives us a foundation for movement. If you think about a baby needs to develop the abdominal strength to sit up. And then it needs to develop the strength in its hips and its arms to be able to crawl. And then we move to walking. So we start at a young age needing this foundation for movement. And then as we move into later stages of life, this same strength is going to help us to prevent a fall or to get up off the ground if we do fall. It's going to help us to continue to be active and to do activities of daily living unassisted. So we want this good foundation throughout our lifespan, and strength training is a great way to give us this foundation. Strength also creates stability. We want more stability in our foundation so that we can handle more load and strain. So this load and strain can be workout driven or it can be daily life driven. So it's not only about swinging a kettlebell like you see me doing here, or picking up barbells or dumbbells. This can be about picking up your baby, about picking up the car seat, or trying to, picking up a large potted plant. You name it, you need strength for it in your daily life. Strength also creates efficiency. So the stronger you are, the more efficient you're going to be in the movement that you want to do. This is really applicable to running. Runners want to be efficient. The stronger you are and the better your mechanics are, which is everything Sam just went through, you're going to be able to run with more ease. And who doesn't want that to make running feel easier? Finally, strength is a skill. This skill can be learned at any age, and it can be taken with you throughout life. Although the amount of weight that you will lift may change, the skill and the form that you learn to lift that weight may not. You're going to need to squat, hinge, push, pull in your 80s, just like you did in your 20s. You just may have a different application for it. So now that I went through a broad perspective of why should you strength train, I know why you're all here and you want to talk about strength training during pregnancy. And the big question there is, can you do it? Can you lift weights during pregnancy? And my answer is yes, 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 you can. But we need to do this with a good strategy and with supervised guidance. So I see a lot of messaging that ranges from you shouldn't lift anything or don't lift more than 15 pounds to just keep going, do whatever you want, listen to your body. You can lift the same amount of weight. It's totally fine during pregnancy. So it's my goal to help you make an informed decision and find a sweet spot in between those two, because we don't have to stop lifting, and we also shouldn't continue to lift at maximal capacities. We need to find the sweet spot in the middle that's going to continue to challenge us and make us strong through this season, like Mbong talked to us about. So when we think about strength training during pregnancy, it's not how much you lift, it's how you lift it. That is what we need to keep in mind when we think about load during pregnancy. It's the strategy that we use to lift the load. So given no contraindications, you are still able to lift challenging weights with a good strategy. So just when you see a positive pregnancy test, that doesn't mean that you need to only pick up the 5-pound dumbbells or the resistance bands. It's not that I have anything against either one of those, but after a while, they're no longer going to challenge you, and you cannot maintain or gain strength if you are not being challenged. So when you're strength training during pregnancy, I've been talking about this strategy. So what does this mean? This means that we need to work with our body to naturally allow it to control pressure and force instead of placing more pressure and force on a system that is already strained. And I'm going to talk a little bit more in depth about this in just a few minutes. But what we know is that this strategy, when learned and applied correctly, can be used before pregnancy, during pregnancy, postpartum, and for years or decades afterwards. And this strategy enables us to use the breath mechanics and the way that our diaphragm and pelvic floor function to enable us to control abdominal pressure and load on the pelvic floor. So there's a saying that I really like, and it's, Once postpartum, always postpartum. So when you grow a baby and you have a baby, regardless of how the baby is birthed, your body changes. It's not like after you're 6 weeks postpartum, then you're not postpartum anymore, or after your baby is 1 year old, then you're not postpartum anymore. You're always postpartum. And that's not a bad thing. Your body will never go back to what it was before. And that's not a bad thing either. You grew a baby and you birthed in some form a baby. So you will never have that body back, and that's okay. But it's just really important to honor that and consider that when we are talking about placing load on our body through strength training. So as Mbong referred to, we want to honor the season of pregnancy. It is a different season for everybody. So some people are in this pregnancy season and they feel beautiful and they're glowing and the hair is amazing and they're just, like, oh, I love it. And then other people are like headache, fatigue, nausea, feel like crap the entire time, can't wait for it to be over. So no matter which camp of those you fall into, we all have one thing in common during pregnancy, and that is that it is not the season for PRs. It's not the season for trying to lift as much weight as we possibly can. It's not the season for chasing after the fastest time ever, lifting weights so sore you can't sit on the toilet the next day, or workouts that just leave you exhausted in a puddle of your own sweat. It's not the season for that. It is a season that we need to honor. We can still challenge ourselves, but we just need to find that sweet spot, like I talked about before, where your season right now during pregnancy is growing a baby. And that is a massive and amazing feat. And we just need to keep your body's priority on that. But there are still lots of things you can do to stay active and strong during that season. So finally, with strength training during pregnancy, or really any other time, I think it's best to keep it simple. So you can see all of these workouts on social media that look super fancy and are complicated. And then you might try and go to do one of these workouts and it's just like a big downhill experience. There is a reason that squat, hinge, push, and pull are still around. And that is because this is a fantastic way to structure a strength training program. And I promise you, if you have each one of those movement patterns in your routine is probably better than that influencer anyway. All right. So if you don't know who this is, you're missing out. This is David from Schitt's Creek. Hopefully most of you are familiar with him. But David is showing us here a really nice example of an exhale. So when we think about this strategy that I was talking about during strength training, this strategy all comes down to breath. We need to understand that breath is going to drive how we manage the pressure in our system. So this is pressure on our core, pressure in your pelvic floor, and it all begins with breath. So as Mbong touched on earlier, we have a dynamic system. So as you can see in this torso here, on the top is the diaphragm. So my little blue circle is there. And as we inhale, the diaphragm is going to come down. As we exhale, the diaphragm is going to come up. Our pelvic floor is dynamic and responsive with the diaphragm. So when we inhale, the pelvic floor moves down slightly to accept some of the pressure from the abdomen that the diaphragm places down. And then when we exhale, the pelvic floor comes up slightly. And again, it is like elastically recoiled. When it comes down, when we exhale, then the pelvic floor is going to come up. So in a non-pregnant body, normally we have this really nice movement between the two. So what happens when you get pregnant? Do you think your diaphragm is able to move down as far as what it was before you're pregnant? Absolutely not. What's here? Baby, contents of the abdomen, that uterus has now pushed up. So we don't get that full excursion of the diaphragm anymore. What happens to the pelvic floor? So as Mbong touched on, the pelvic floor's job is to support your organs, the contents of the abdominal cavity. What gets added to the abdominal cavity during pregnancy? A baby, uterus, amniotic fluid, all of that stuff that if you've ever been pregnant or you're pregnant right now, you know it is not light. It ends up, it feels heavy in there. So the pelvic floor has to support and take on all of that load during the whole pregnancy. Then what about your deep abdominal muscles? So those are your transverse abdominis. Those get lengthened and pushed out as your belly grows. And we know that when a muscle is in a lengthened state, then this impacts its function and capacity. So your transverse abdominis muscles are not able to function in the same way that they were when you were not pregnant. So what does all this mean? How do we navigate this perfect storm? So we have our diaphragm that can't move down as far. Our pelvic floor has more load on it. Our deep core is in a lengthened state, not able to contract like it once could. What do we do to help manage all this? What we do is give this system TLC. So we want to give it more attention now during pregnancy and postpartum healing than what we were before. So when we think about this system, instead of calling your core or thinking of the core as we typically do, like six-pack muscles, we want to think of it as a central stability system. So all of these pieces are working together as your core. They're that foundation that I was speaking of before, and we need each part of our foundation to really be functioning well. Each part talks to the other piece. So we don't want to have the pieces out of sync or have a kink in any one of those. By giving the central stability system more TLC activation stimulation, we retain the ability, hopefully, for each one of these pieces to function better. So you might say, well, then how do I do that? And we do that with breath. So this is something that I'm not going to go too in depth in right now, but an exhale is going to drive the activation of the transverse abdominis, the pelvic floor. When we inhale, we're filling the diaphragm with, the diaphragm will descend and fill with air. And that's going to help just this whole dynamic system to be more responsive. And when we think about strength training, we want to think about integrating this systematic approach. So you can turn any exercise into a core exercise. We don't have to do core specific exercises. Those aren't really appropriate for the most part during pregnancy anyhow, but this is how you want to think about training your core during pregnancy, is with this whole system approach. Okay, so what we want to do is, I'm going to share this with you in a different way, actually. Sorry. One. Let's see. I need to do a new share. All right. So what we want to think about is strengthening this system. And how do you do that? Really, we can use moves that you wouldn't think of as a core exercise. The deadlift is one of my favorites. So this exercise strengthens your whole posterior chain. That means your calves, hamstrings, glutes, back, and quote unquote core. But when we do this with that strategy that I was just talking about, we're making sure that we're limiting the load on the pelvic floor, we're activating the deep core, and we're also helping the diaphragm drive that movement. The pow-off press that you can see on the right, this is an anti-rotation movement. I really like this one because we don't have as many moving parts. So I find that it's easier to really kind of hone in on the pelvic floor during this one, especially later in pregnancy. And we can feel that pelvic floor responding to the breath pattern. And we are working on resisting the rotation to the side here. Okay, so let me share this next one with y'all. Sorry, this was giving me a fit in Canva earlier. All right, so Sam touched on rotation. The wood chop is a great way to keep incorporating rotation while you're pregnant. This is something that often gets overlooked. So what happens during pregnancy is we basically kind of like the abdomen creates a unijoint, if you will, and we really move all as one unit and lack the ability to retain rotation. This wood chop allows you to keep connecting with the muscles that help to facilitate rotation. And just because these muscles are not in quite as strong of a state as they were pre-pregnancy doesn't mean that we can't still use them and really make sure that we're training the pattern. Triple extension. So when we think about strength training, it's not only about slow, heavy reps or lightweight, high reps. You want to think about power too. Triple extension is a great way to work on power. And what I'm doing here is I've just got a weighted medicine ball that I'm kind of tossing overhead. But this is great for running because it gets you into extension at the feet, knee, and hips. So we were talking about how important that extension pattern is. Sam went through a lot of that, and this is a great way to train power. So really quick, explosive movements while getting that hip extension at the same time. So let me go back to the presentation. Okay, so you might be like, well, Joy, that's all good and well, but how am I supposed to fit this in? A great way to fit it in is to do it during your warm-up. And during your warm-up, we want to use patterns that are going to mimic running. We want to target single leg strength and stability. We're not going to overlook rotation. And again, we want to keep it simple, right? There's no reason that a workout has to have, you're not seeing the slides. Oh, sorry. Thank you for telling me. Let me look real quick. Oh, share screen. Thank you, Sam. Okay, here we go. You see him now? All right, thank you. Yeah, so fitting it all again, we want to do this. A great way to do it is during a warm-up, targeting those patterns that are going to mimic running, single leg strength and stability, not overlooking rotation, and definitely keeping it simple. Just because it's 10 or 15 minutes doesn't mean it's not worth it. And I can promise you that spending those 10 or 15 minutes on strength during your warm-up will be a lot more beneficial to your running, whether you are pregnant or not. Those 10 or 15 minutes that you miss out running, your body won't miss it. It's really important to find a way to fit the strength training in. And I've found for a lot of runners that I totally get it. They just want to run. They don't want to strength train. But using strength in a warm up, you're going to feel better when you get out the door because those muscles are going to be ready to go. And also using strength training in an appropriate way to activate that central stability system we were just talking about can also remind the pelvic floor, the deep core, hey, wake up. We're getting ready to go. Using some dynamic patterns therein. All right. So go on to the next one. I'll see if it'll play in here. So this single leg, no, it's not going to do it. This single leg hinge pattern is a really great one, and I want to show it to you because Sam was talking about the glute med, and I love this one for the glute med. So what I'm doing here is this is my working leg in the front, and I am using my leg to press this foam roller into the wall. During pregnancy, we have a lot of external rotation already just because of the way that the hips and the pelvis are widening. This is using a little bit more internal rotation. And if you have done like the lateral banded walks before, I suggest trying this. I cannot claim this as my own. This is from Allison Helms. If you don't follow her on social media, I highly suggest that you look for her. But this one is amazing for the glute med. So the next one you're looking at is a running woman. I think this is running man, but I decided we're going to call it running woman because that's more appropriate. Anyway, so this running woman is a great way to warm up for running. You're also working on that single leg strength, stability, and extension. You can also turn this into a more dynamic movement by coming up on the toe at the end, because we do want to remember that running is dynamic, and we want our body to realize we're getting ready to go into a more high impact dynamic state, and doing movements that mimic that will help. All right, so I've got a couple more I wanted to share with you. 3, 15. So here are two that I really like. One is appropriate for early pregnancy. The second one is great for later in pregnancy. So I'm going from a bear to a down dog. Bear is great for activating the deep core, pelvic floor, and that down dog is really great for getting in a little more mobility with the hamstrings and also lengthening the glutes and learning how to relax the pelvic floor. So we want to remember that strength in the pelvic floor is great, but we also need relaxation in the pelvic floor. So later in pregnancy, when we don't want to have as much gravity pulling on the belly, this supported bear against the wall and down dog feels really nice. And actually this plank on the wall I love this because it gets the ribs and hips in a stacked position. That's what we really struggle with during pregnancy because of our belly pulling us forward, like Sam talked about, the spine, the lower back going into lordosis. And so it feels really nice to get back in that stacked position. All right, so I've got one more that I want to show you, and then we'll wrap it up. Let's see, let me share the screen. Number 4. Okay, so single leg glute bridge. This is like a classic, but for a good reason. It's because it gets that same running. You look at that hip extension right there. That's what Sam was talking about in the biomechanics. And this is a really great one to do before pregnancy, during pregnancy, after pregnancy. Hip strength is also, we found that it's correlated to pelvic floor strength. A little too in depth for this clinic, but do your single leg bridges. I promise they will help. And then again, the wood chop. So this movement in a warm up is really incredible because it gets you working some of that rotation that we want to be able to work back into running, especially postpartum. All right, so we've got one more. Oops. Let's see. Stop on the screen. Sorry, guys. Okay. You see that, Sam? Okay. All right, cool. So this one last tidbit I want to leave you with is train the brave. So Mbong talked on this a little bit, that we don't know what pregnancy is going to throw at us. We don't know what motherhood is going to throw at us. New babies are about the most unpredictable things in the entire world. But just knowing that you are strong no matter what you do. If you worked with none of us or you worked with all of us, that is okay. And your body is completely capable of handling a pregnancy, of handling the postpartum experience, but it is always beneficial to know and have support behind you. So just knowing that none of us have it all together. We all still get scared, intimidated, feel like we're messing up. But if you just learn how to train the brave and just, a little bit every day, you just do one thing that makes you feel brave, you will be amazed at over time how much that one little thing every day can really lead to some huge impacts in your life. So I just wanted to leave everybody with that you are strong and you are brave, and we're all super happy that you came and hung out with us tonight. So lastly, we want to give a quick shout out to Bull City Running Company and Fleet Feet. These are amazing running stores in the Carborough, Chapel Hill, Durham area. If you need a new bra, new shoes, apparel, you're looking for a running group, nutrition for running, they can set you up. They're the people to go to. And lastly, we want to thank all of you because you are the reason that we're doing this. Our passion lies in being able to empower you with information to help and guide you through this experience of pregnancy and postpartum. And we don't want you to be in pain, or we don't want you to wonder, like, can I do this? Should I do this? That's literally what we're here for. So we hope that at some point we'll be able to, possibly work with some of you. And yeah, I think that's it.